Hello, my name is Leandre Flowers, and I'll be presenting the synergistic strategies to myeloma treatment, the ketoconazole effect, and this is for class R606. My thoughts and opinions on this study and why I chose it. Myeloma is, in most cases, a terminal illness, and the prognosis for many people afflicted with this ailment is not good and is in the advanced stages. It can go from a few months to maybe a couple years if you're lucky, because it's very rapid, and it's very aggressive. So I think that by um, advancing these rare diseases and looking into remedies and concomitants with medications that we have today, being able to give people any additional time left with their family is of the utmost importance and paramount, as you really can't put a price on a human life. And it just really stuck out to me, and it was very interesting. So the first medication that is involved in this study is bortezomib, and it is a proteasome inhibitor, and that is typically indicated for the treatment of myeloma, which is a type of blood cancer, specifically a cancer of the blood plasma. And it works by inhibiting proteasome, and this reduces the instances of proteins being able to break down within the cell. And they just sort of accumulate within cancer cells until the cell dies, and this is especially effective in the treatment of myeloma. The second medication that is involved in this study is called ketoconazole, and this medication is typically found over the counter in a lot of everyday products used for antifungal treatments. You may have seen it in creams. It's also available in tablet formulations as well for more advanced forms of antifungal and bacterial infections. This medication is really effective because it inhibits the prohormone ergocalciferol, which is an essential component of the fungal cell membranes, and um, and it leads to the cell death. Some of the relevant side effects of this medication are the hormonal abnormalities associated with it, contact dermatitis. Some people don't tolerate it very well, and the potential prolongation of drug effects. So what's really interesting about this drug-drug interaction between these two medications is that they're from vastly different drug classes, and they're not typically seen together in concomitant therapies as of yet. And so ketoconazole is a potent inhibitor of the CYP3A4 enzyme, and this usually affects the metabolism of a plethora of drugs, including some that may interact with bortezomib. But what makes even though bortezomib isn't a primarily metabolized by the CYP3A4 inhibitor, it still has drug-drug interactions with that specific enzyme. And so, while it's not direct, it has a statistically significant interaction with it where we can kind of meddle around with it to explore potential drug remedies. And that's what makes uh, this very interesting. Drug-drug interaction clinically relevant is that ketoconazole has a side effect of lowering the clearance rate of drugs within the system. And when used in conjunction with bortezomib, the clearance rate of the cancer medication is lowered and it concentrates a bit more within the body, despite it not being mainly linked to the CYP3A4 enzyme. And myeloma is notoriously difficult to treat due to it being a blood cancer. So the prolonged exposure, what the researchers were thinking to bortezomib could potentially be beneficial to those afflicted with myeloma. The current lexicon recommendation, it isn't misleading, but it is very circumstantial, and it's highly dependent case by case, because myeloma is typically put into two categories, which is standard risk and high risk myeloma treatments. And people on standard who have standard risk myeloma, they may only need bortezomib and something like dexamethasone, whereas more advanced stages of myeloma, you may have to go for more aggressive treatments. But that's actually one of the problems with the current drug therapies that exist now, is that while you can have a two, three, or four drug cocktail, and they may be quote unquote more efficacious. They're also way more toxic, and compounding those medications, you're also compounding the potential adverse effects associated with each individual medication, along with the drug-drug interactions associated with each. So I think it's very important that, and Lexicon even recommends looking over and making sure that the risk outweigh I mean that the risks don't outweigh the reward of each drug therapy that you choose currently. So the type of study that was conducted, it was a prospective multi-center open label randomized multiple dose two-way crossover study. And who was studied in this who was studied was mainly comprised of older Caucasian men with advanced solid tumors. They made up the majority of the 21-person sample size, which was they were compromised over 56%. So it was rather homogeneous. And what was done in the study? So basically, the patients they received bortezomib, 1 milligram via injection on days 1, 4, 8, and 11. And this also included two 21-day cycles. The aspect of the study that was randomized was the distribution of the concomitant ketoconazole, 400 milligrams, and this was given on day 6, 7, 8, and 9 of the first and second cycles during the study. There were a lot of strengths that I personally liked about the study. It was performed in accordance with the guideline for good clinical practice. There were several exclusions that limited confounding variables, such as patients who had HIV or other immunodeficiencies. They were excluded from this particular study. The study was randomized to cut some measures of bias and to better reflect the some measures of treatment. Another strength of the study is that the researchers measured for any adverse effects 30 days after drug activity and measured the possible toxicological effects of the drug. And another aspect I really liked about this study is that it was multi-centered. So while it was a rather small sample size, they had three different locations that they pulled people for this study for. So I think that did add some level of like extra security to their results that they got despite some variables that didn't really sit right with me. Quite a few things I did take issue with the study. There are inherent limitations with open label studies due to the high risk of there being a bias present when analyzing the results. Also, another limitation is the way that the cross-sectional study was carried out. There was not, at least from what I read, an effective washout period to allow for a true measurement of the effectiveness of the treatment. The I really don't like the sample size. It was extremely small with only 21 patients. I would love to see this study replicated with a larger sample size, just to further solidify the results on a larger scale. Um, and the homogeneous nature of the group, it was 67% male and 80% white, and this can lead to weaknesses amongst other groups. But I am being considerate of the fact that it's a bit harder finding a sample population to test the treatment for such a disease due to its aggressiveness and its rarity. Some limiting factors that I observed are that there was a manipulation of the dosage of bortezomib if therapy wasn't well tolerated. So after the second round, at the discretion of the investigator, the dosage could be raised all the way up to 1.3 milligrams, or it could be lowered to zero point 0.7 milligrams. And concomitant medications and other medical therapies were still permitted during this time for the duration of the study, apart from other annealoplastic agents. And this raises a few questions about the actual effectiveness of the efficacy of the medicinal combo. Because I'm like, are there any possible confounding variables that, may have sprung up as a result? That while the study size is very small, I think the results of this study are of paramount importance as we have a very aging population. We're going to have a lot more people possibly getting cancers of many types, I think that it's important that we go ahead and be proactive with exploring different drug remedies and therapies that can suit a wider audience. And I think the statistical outcome for this particular study was statistically significant. It came out, there was a 35% increase in the bortezomib uh, systemic exposure with no additional risk measured to the safety of test patients. And as far as the applicability of this study, the results may not apply to healthy individuals or those with early stage myeloma, where alternative treatments may provide a better tolerability or efficacy as researchers explore this drug combo a bit better. And these are my citations, and thank you.